Now, children in the grip of COVID. Brisbane's school cluster is seeing infections rise, forcing parents to make impossible decisions about the care of their kids.
And I know that that's tough, but I think any parent would make that decision.
I'm having flashbacks from last year and the lockdown.
One of the children is, I believe, in intensive care.
We do have a lot of children in hospital, but they're not particularly unwell, but they need to be in hospital.
It's the front line in our COVID fight, filled with positive cases of children, and the numbers are growing.
Thank goodness we have got the Children's Hospital, which is one of the best hospitals in Australia.
As more hospitals are placed on standby to deal with our youngest ever patients, the Gold Coast University Hospital is already treating 39 children and adults battling the virus. Regarded as one of our best COVID hospitals in the state, it treated Australia's first patient 18 months ago.
On Tuesday afternoon, he called an ambulance and was taken to the Gold Coast University Hospital.
And Hollywood couple Tom Hanks and Rita Wilson.
Thanks to our friends down under who guaranteed our safety and saw us through.
Dr. John Gerard is the head of infectious diseases at the hospital.
These are isolation rooms with their own airlock, with their own separate ventilation system, and staff wear personal protective equipment when they enter the room.
He's worked in West Africa during the Ebola epidemic. He's treated some of our sickest flu patients.
It is a particularly bad epidemic just in terms of the sheer numbers.
And this was Dr. Gerard in February as Australia's COVID vaccine rollout started.
Now we're seeing what looks like the beginning of the end of this pandemic.
Now his hospital is back in the thick of it, treating mounting paediatric cases from our latest Delta cluster.
It is a top-notch university hospital, so it can handle these kids.
Dr. Chris Perry is the Queensland president of the AMA. He says the hospital had to make the tough decision to let parents in to be with their children, despite exposing them to the virus.
It's terribly distressing, and you can say probably, your child won't get terribly sick and probably won't die, but probably is not 100%.
Any parent would want to be with their child and they would take that risk.
Michaela Sargent is in home quarantine with her husband and 2 daughters.
Before, it never really affected kids. It was more, I was worried about my mum or dad catching it.
The girls attend 2 of the schools with positive cases.
Had incredible support from the community, which has been really hard because the majority of our friends are in quarantine as well.
So far, her daughters Ishika and Anisha have tested negative, but one of Anisha's classmates is positive and now in hospital on the Gold Coast.
They seem to be managing really well, really positive. It was wonderful. His only message to his classmates was, I'm doing fine, I'll join you for the class chats and just make sure that you all get tested.
Michaela says her family decided early on no one would quarantine alone.
We early on made the decision on the Thursday night, held a family meeting that we wouldn't ask our 13-year-old to quarantine by herself in one room.
That's despite any parent who chooses to go to hospital with a positive child having to do double quarantine.
They'll have to quarantine for 14 days after they've last had exposure to the infectious case.
There's currently 65 cases of COVID being treated in our hospitals, and for the first time since the pandemic started, the Queensland Children's Hospital here in Brisbane has started to take on cases, and that's due to the surge in the number of children needing treatment for the Delta strain of the virus.
They'll get better and go home, and it'll be a bit of a bad memory for them and a terrible memory for their families, but hopefully nothing more than that.
Along with thousands of other people in isolation, Michaela and her children have 8 more days in quarantine and a nervous wait for their second round of tests on day 12.
I didn't know now, but I didn't know then, but now I know that I could be affected too. So this is, I'm definitely going to be more cautious now.
And I thank every single one of those households that went into quarantine when they were asked to do so.
Let me just say that I cannot wait for it to be over.
Yes, all of us in the same boat.